minutes to drain all the, because in all area we have to repeat your strokes for 5 to 7 times, right? After giving all these sessions, this also have some abdominal techniques, because we have to stimulate the abdominal lymph nodes, because after that from the limb it will go directly to the abdominal area, and from the thoracic duct it will end into the venous angle. So we have to give some abdominal techniques to increases the lymphatic flow towards the venous system. After my manual lymphatic drainage, I will do compression. Why? Compression is important because always a risk is there for the reaccumulation after the decongestion. After you have decongest the area, the lymphatic fluid will go. The patient will experience this lymphatic movement. I'm not boosting, or I'm not telling any lie, but the patient will experiences the lymphatic fluid, they are moving. We also can experience it, the fluid is moving. They will experiences the lightening of the limb. But after that, always a risk for the reaccumulation. So to prevent this reaccumulation of the evacuated lymphatic fluid, the compression is required. Compression, it also improves the efficiency of the muscle pump and the joint pump, and it provides the support for the tissue that have lost that elasticity. So here you can see in phase, we are giving short stretch bandages. It has also a different techniques how to tie all these bandages. It is multi-layered bandages. We have to bandage 3-4 bandages are there. It should be layered, and that's require a specific skill to tie it properly from the fingers to the to the axilla, and it requires specific skill, and it's a multi-layered bandaging technique that will prevent the reaccumulation of the fluid. So after giving my MLD that lasts 30 minutes, I will do this bandaging, and that bandaging the patient has to maintain this patient has to keep these bandages for 24 hours. So when I go the next day, I will remove the bandages, and again I will go for my next MLD session. So this is in phase 1. The patient has to maintain that bandage 24 hours. But what happened in phase 2? When my 1-to-1 treatment is over, the patient is doing all the self MLD, all the patient is doing by his or herself. At that time, patient can wear these compression garments that is shown in this figure also. The compression garments, these are available in the market. I prefer this Medi company, and the different companies are available, but the results of this company is very good, and I prescribe my patient these compression garments from this Medi company. That is available for upper limb, that is also available for lower limb. You have to select according to the class, because if it is upper extremity, that should be class 2 compression garment, and if it is lower extremity, it should be class 3 compression garments. But it also depends on the specific conditions. If the patient is having arthritic hand, if the patient is having paralysis, if the patient is older age group, then we should reduce the class from 2 to 1. But if the patient is athletic patients, very active patients, they may require more compression, younger patients. So in that, we should give more than class 2. So we have to decide the class according to the patient's condition. But this is must for the phase 2, where patient has to maintain the reduction whatever we have achieved. These all are also available in a market. These items, there's you can see there is the external silicone breast prosthesis, mastectomy bra. So these all are also very helpful to the patients. So patients, they can do their all activities, and they improve that quality of life of the patient with all this, and that is readily available in the market. After the compression garments or with the bandages, patient